The following podcast is a discussion between two experts in their fields of beauty and not meant to be taken as medical advice. Be sure to consult with your doctor if you have any medical inquiries.
Okay, so I am pleased to be joined by Bailey Dwyer, although that won't be Dwyer for that much longer, right?
Not much longer.
Okay, and Bailey is one of our amazing injectors, and she's been here for over a year, and we're going to focus on a different area. We're going to be focusing on the upper part of the face, specifically under eyes and temples, and ways we can do things to rejuvenate them. Before we get started, Bailey, what's your middle name?
Nicole.
Nicole. Did you know that? I didn't know that. And then what does your mom call you when you're angry?
Nothing.
Didn't
She
say
just
your
yells.
middle name? Or just
She doesn't
yell?
get angry at me.
Really?
She loves me.
Wow. That's amazing. My mom has lots of names for me. She has
I
like
have
a
a
series
nickname
of nicknames.
I have a nickname of Bales that my friends call me. but
Bales?
I don't know where that came from.
No idea. There's
Yeah.
nothing that earned it? You
No.
wasn't like, okay, cool. But anyways, we're talking about the upper face for patients. Let's start with the under eye area. So lots of patients come in for the under eyes. Who's going to benefit, and who are you a little bit leery about treating?
Yeah, so I do really enjoy treating the under eye area. I think it really does rejuvenate the face, helps reduce the tired appearance. I find that some people are kind of born with that kind of, shadow under their eye at birth. My fiance, I stare at him every day and I see his under eyes. He won't let me touch him. But I see people like that are younger that I think could really benefit from tear trough filler just to help volumize that area, help reduce the shadow and bring a little bit more light and less tiredness to the area. On the other hand, I think we have to kind of caution ourselves with the older people. A lot of times they come in talking about a puff under their eye, or they feel like they have bags under their eyes, and they're looking for something to help with that. I actually had a patient earlier today that we were talking about that. She actually lost 110 pounds over the course of a year with gastric bypass. So we were kind of talking about all the fat loss that she's had from her face, and obviously she pointed out her under eyes. So she's in her mid-40s, so she was really complaining of that puff, that under eye area. That we kind of talked about option-wise. We talked about filler, how we can kind of help camouflage the area, just to try and help add some. We also talked about surgery as an option for her as well. So she wanted to try out the filler, see how she liked it, and then I told her later on, maybe in a couple years or something, consider a lower blepharoplasty to get rid of that little puff or that little fat pad under the eye.
Cool. So it seems like that's the dichotomy. When you're looking at patients, it's if they have a puffiness under their eyes, and the technical name for that, and we're keeping it simple for our podcast, but the technical name of that is going to be the herniation of the fat pads. When that herniation of the fat pads is too prominent, sometimes it's hard to put filler there because you're just going to create this big puff. Mm-hmm. And if it's more of a hollow, they're great candidates for filler.
And they look great after.
Cool.
Yeah, so it's a tough one. It's a tough area to treat, but it's very rewarding.
Patients ask this all the time. Will filler remove my darkness under my eyes? How do you talk to them about that?
So I set expectations. So I say sometimes it can help improve the darkness because we're kind of getting rid of that shadow that you're seeing. But sometimes the skin is kind of a little bit darker of a color, which filler may not be the answer to it. So I can say, yes, expect a little bit of, reduced in that darkness, but there's other options to kind of pursue if we're looking to help with that.
Yeah, and I call it like the ocean. Like, the deeper parts of the ocean tend to be darker, and the more shallow tend to be a little bit brighter blue. So what do you like to do if someone comes in with that discoloration under their eyes? What are the things you're going to do after you do filler, let's say, and they still have discoloration?
Mm-hmm. Depending on if we feel like it's a skin pigment issue, we like to do the pico laser, which helps kind of target those dark areas, helps kind of brighten that under eye area as well. PRP is sometimes, something that some patients like to do just to help kind of rejuvenate the under eye area. Can help sometimes with a little bit of that darkness.
Yeah. So again, sort of brightening approach. Again, pico, IPL, PRP. PRP is the one I always forget to talk about as much too. PRP is when you draw your blood out, spin it, and put it underneath your eyes. And I'm not sure the effect of why PRP lightens things.
That I don't truly understand. I don't think anybody really has a solution to it. I think it does kind of help add, just like the growth factors and everything back to the area, just like if we were doing it to the scalp. Same idea. But, it's not as much of predictable as some people
but
hope.
It does seem to brighten that area up. And then if they have fine lines there, what are some things you like to do to treat the fine lines, non-surgically, of course?
Yeah. So if I find that the eye muscle is really creating some of the finer lines in the crow's feet area, definitely treat the crow's feet. Sometimes I'll do a little micro droplet right under the eye just to help kind of soften that as well.
And you're talking about Botox or Dysport. Is there one you prefer? Or?
I like both. I think some work better for others, but usually I start with Botox if they haven't done it before. And then next route, we actually, with that patient earlier today, we also talked about the under eyes because she was having a little bit of that crepiness that she was describing under her eyes. So we talked about CO2 as being an option just to help it's actually a laser, so it resurfaces the skin to help smooth and soften those little fine lines, those little bit of wrinkles under the eye.
Yeah, to me, that's, you can definitely hit a home run with under eyes. You can fill in shadows, tighten the skin, get rid of some of those colorations, and then get rid of some of that muscle movement, and it can make a big difference. How about, we're going to work our way up into the temples. What are your thoughts on temple filler? Who needs it? Who doesn't need it?
Yeah. I always love to see patients come in asking for it because not many people think it's a treatable area. It's an area that isn't as common to fill, but I think makes a huge difference in people. As they're losing fat in this temple area, it kind of starts to recede. The transition between that cheekbone and the temple is just a little bit harsher. So I find just softly kind of plumping that area back up really does rejuvenate and, make people look a lot younger.
Is there a specific filler you like to place in there?
I think it kind of depends. I've been using a lot of Define recently, Restylane products with that, and it works pretty well for me.
Yeah, I agree. I think you can put almost any filler in there. It's going to work well. It needs so much volume. When I think of temples, too, I think of them as almost kind of like you can put a lot of product in there. You can almost put 10 cc's of fat. And it doesn't seem always to make a 1-to-1 ratio, but it seems to make everything else look better. And it's kind of that complex milieu of aging where even if you inject another area, an unrelated area can look better, I think.
Yeah, I agree.
Cool. So temples, under eyes, that was a short podcast, but super important areas. And if they say the window to your soul is your eyes, you better improve the window a little bit. Clean it up with Windex. In this case, filler.
Yeah, I
So
agree.
cool. Thanks for joining us, Bailey.
Of course. Thanks for having me.